Joint replacement surgery is a major operation. These procedures normally cause a significant amount of pain. Without anesthesia, this surgery would not be possible. Using a combination of treatments and medications, we will help to make your pain manageable after surgery. You will probably still have pain when you're getting ready to leave the hospital, but it should be much less than it was immediately after surgery. And it should continue to get better during the first weeks after surgery. We will use a combination of things to help you work on making your pain better after surgery. Most of our patients will have spinal anesthetic for surgery. With a spinal anesthetic, your legs are put to sleep, but you are not fully under anesthesia. This will allow you to start taking medications after your surgery before your legs wake up. This decreases the strength of the pain sensations that you may experience. During your surgery, your doctor will inject medication into the soft tissues around your knee. This injection helps to decrease the pain that you would otherwise experience on your day of surgery. Most patients will notice that their pain is a little greater during the first night and the next day after the surgery than it was immediately after surgery. For patients who have a general anesthetic, our anesthesia team may offer you an injection to some of the nerves that run around your hip or knee. This will be given in addition to the injection that your surgeon performs on the inside of your hip or knee. The anesthesia nerve block procedure can help to decrease pain, but sometimes they also make the muscles around the hip or knee weaker. It's important for you to be confident that your legs are awake from the medicine before you start getting up to walk around your room or in the hallway after surgery. We will use a device that circulates cold water in a protected pad around your surgical incision. Cold therapy decreases inflammation chemicals and can help to decrease pain and swelling. We recommend freezing 12, 16 to 20 ounce bottles of water to use in place of ice cubes. This makes it easier to keep up with the ice demands. While initially moving your knee or hip after surgery can reproduce pain, the process of getting the movement of the joint back as early as possible helps to decrease long-term pain, swelling, and joint stiffness. We will also use a combination of medications that help you control pain during the first days or weeks after surgery. Keeping your mind engaged with other things can help to decrease your mind's focus on pain. You may consider a variety of things that you enjoy. This can include listening to relaxing music, watching television, reading, working on a laptop computer, or visiting with family and friends. Our main goal is to have your pain reasonably controlled with pain medications that you take by mouth. We use 4 different types of medication to help you with pain control. None of them completely removes the pain by themselves. When given alone, many of them may not seem to do very much, but when they are given together, they can be very effective. Medications taken by mouth can take as long as 30 minutes to start working, so it's important to ask for them before the pain gets to a point where it is severe. If you take anti-inflammatory medications, we will prescribe either Celebrex or meloxicam for you to take. These will help to reduce some of the pain and swelling that you would normally experience. We will give you a scheduled acetaminophen or Tylenol as well. Many people will develop a fever after surgery. The acetaminophen will help with the pain, but also will help keep your body temperature and not your room temperature better controlled. We may also give you a medication to reduce the intensity of pain from nerves that are responding to the injury that is caused from surgery. Some people are more sensitive to these medications than others. If you are experiencing slower thinking, speech, or other concerns, it's important that you stop taking those medications. Finally, we will have narcotic pain medications available for you to take. Some patients who are having hip replacement surgery may not need a very strong narcotic pain medication. Most patients who have a knee replacement will have to take one of these medications during the first 1 to 2 days after surgery or longer. It's important to avoid taking these medications too much, but during the first 2 to 3 days after surgery, it may be helpful to keep taking the medications more regularly. But after the first 2 to 3 days from surgery, it is important to start taking less and less of the narcotic medication. We have learned that patients who do not start taking less of these medications within the first 1 to 2 weeks after surgery may have trouble stopping taking them later. After surgery, we will decrease the strength of the medications you're prescribed during the first week after surgery. Using strong narcotics or opioid medications like oxycodone or hydrocodone for a longer period of time can make your pain sensations more intense over time. Many patients have learned about this the hard way in the past.